hydra ointment over it, and you're gonna go ahead and do a pressure dressing yourself. So you can just put some gauze and some tape. We do have aftercare kits that come with gauze and tape for them to last them the time that they're gonna be having to change their bandage. So we let them know. We also have a kit that has all your aftercare instructions in there, and it also is going to have some gauze and some tape, that way you don't have to run to the store and get that for yourself. You can go straight home and relax.
Can I see what it looks like?
Of course, I'll go ahead and bring that right out. I'll be right back in. So usually we'll have some in here. I need to restock that. If not, we have them out in the lab. So I'll show you this where we keep them as well. We're going to have them with all of our aftercare kits right here. So we have the one with the gauze and the tape, and then we add some ointment in there as well, and we have written instructions. So I'll go ahead and take that to her, and we'll go ahead and show. This is our aftercare kit, so it does come with enough tape for you to go ahead and wrap it, and then the gauze, you're just going to go ahead and cut it to the size of the wound. So the pressure dressings you're going to do at home, they're not going to be as big as this. This is just to help stop the bleeding for now. But after, you're just going to cut the gauze to its shape and put some tape around it after you put the honey gel on it. And we also walk you through all the steps that I've gone over on the paper as well. Okay? You want to go ahead and do this bandage dressing every single day until your suture removal. Okay? Okay. Did you want to go ahead and take this in the honey gel?
Can you tell me how much it is?
Of course, the honey gel, it is $12, and the aftercare, it's $10.
Okay, yeah, I'll take it.
Of course, I'll go ahead and get that ready for you. I'm going to go ahead and get your total for today. If you want to start looking at your calendar to get a 2-week suture removal for you, I'll be back to help you set that up.
Thank you.
So usually you want to be time efficient. So most patients are very busy, and they need like an exact date to come in to get their suture removal, specific time. So if they look at their calendar, it's easier for you to get like a date where you can get them in. They can go ahead, and while you get the total, that's why we need your codes. Reason why I told you guys we need to add this plastic nevus excision and the repair complex. When we go ahead and go to the progress note, we can see this is like the billing codes. Okay. We can see that the procedures that are going to be charged for today, it's going to be the complex repair and the excision. So that way we know what to charge from the front end.
And that changes depending on the size and the location, so that has to be accurate. So if the size is like 3 centimeters versus 1 centimeter for the excision, it's really important that you have the final size, because otherwise then they'll get a balance bill and they're not happy with us.
So you want to make sure that before you go ahead and get the cost estimator, you want to go ahead and go to your mannequin. And this is why it's important for you to remember how much lidocaine you injected and the final size. So the way you add the note, you will go ahead and click on here. Go to the scalpel, and we're going to go ahead and start with the excision. The initial dimensions will be the dimensions of the actual biopsy site. Okay? Usually it auto-populates when you grab it from the time clock, but if it doesn't, we go ahead and do diameter. Let's say the initial ones were 0.3. Wait, Dr. You had said that's the biopsy, and then the bottom ones, it's the area, right?
Yeah, because we have to add the margins.
Yes, okay. So we go ahead and make sure we have our photo. We want to go ahead and add how much lidocaine she injected. So she only injected in the initial part of the excision, so we're going to go ahead and click on here. Go to volume and switch that because she injected 3 ml. This auto-populates. In the case that the patient was allergic to epi, we would inject them with lidocaine with no epi. So we would go ahead and have to click on here and change that. So we would type in lidocaine without epi. That's the topic one. So you would go ahead and find which one would be the one for you. So we inject it. And you change how much she injected, okay? Go ahead and press done. Cancel there. And we're gonna go ahead and make sure that the electrocautery, it is always the mono, so it automatically populates this way, but in the case that it didn't, the way you change it is you click on the right one. So let's say this one said that instead. You're gonna go ahead and click on mono, and you're gonna go ahead and remove the other one. You press done, and now it's changed. Okay. Now here, we use the surgical scrub HIPAA cleanse. If it said something else, again, this auto-populates, but let's say it said both of these, Retinol and HIPAA cleanse, you want to remove this one. So you just press on it, press done, and there we go. So now we have the surgical margins. Those would be of the margins of the excision. So let's say that was 1.1. Okay, and now we're gonna go ahead and press close, and we're gonna go ahead and work on the repair. So you're gonna go ahead and click on there. This auto-populated from the beginning of the excision. We have our final photo. Dr. Kormeili did not inject any more lidocaine to close, so we have to make this a 0. If she did inject more, then you would put the quantity that she injected. Press done, and done. And now we're gonna go ahead and make sure that these sutures are correct. So we go ahead and sometimes she'll use, for most cases, she usually uses the same, like if it's 4.0, she'll use 4.0, but sometimes for a plastic surgeon, Dr. Sandifar, sometimes he'll use a 5.0, 4.0, 4.0, 5.0. So you always want to be aware of what sutures are being put into the patient. So we can adjust it by clicking on it, clicking again, and then we can do the suture sizes, suture type, and the technique. For Dr. Kormeili, it's usually dermal, subdermal for the first ones. And then for the outer ones, epidermal, we can edit here as well. And let's say that the technique was a different one. Let's say she did running locked. We will click on it, press back, and press done. Go ahead and press that, and I changed that there.
It's all pretty much defaulted to the settings that I use. So the nice thing is most of it is set up right. So you just have to make sure you get the final length right. And then sometimes the biopsy doesn't have the measurements, so it doesn't populate it in. Like in the beginning, don't feel bad if you ask me how much it was, because usually like the biopsy site, like when people come back, it's even bigger. So that's really what we're cutting out, right? Because there's like a little bit of edema and swelling around it. So let's say we took out like a 3 millimeter biopsy, the patient comes back, and there's actually a little bit of residual. So now the actual lesion is bigger, right? Because we might have taken a piece of it. So it might be that we cut out 1 centimeter and then we have margins around it. So we went 2 millimeters around it. So now it's 1 centimeter plus 1 millimeter and 1 millimeter, right? So it's 1.2 that we're cutting out, and then the final length of the excision. Does that make sense?
Mm-hmm. The final length of the excision will be right here on the repair, and then that's the one that we take from suture to suture. And we would go ahead and just adjust it. So let's see, this one was 3.2. I press that, and your node is done. We can go ahead and close. So again, you need measurements before we can do the cost estimator, because they can have a price change depending on the size of the area and the location. So once you have this, we can go ahead and get the cost estimator from the front, and we can also go ahead and, in this case, patients taking the honey gel and the suture, the aftercare kit. So we would let the front know as well that they're taking that, so they can go ahead and add in the items. We get the total, we'll come back in, we hand the products to the patient, so we'll hand her the honey gel, the aftercare. Let's say in this case, patient only wanted to take the honey gel, but they already have gauze and tape at home. They didn't need this aftercare kit. We still give them the written instructions. And as a courtesy, we give like some Band-Aids and some ointment. Thank you. So if the patient didn't want to take these, they still get an aftercare kit. Okay, and then this one we don't charge for.
And from the credit card, you can actually enter the charges too if
Yes.
you wanted to. So if sometimes the front may be indisposed and you want to make sure they have the proper total. So remember how we did the fillers yesterday? So you can go to the credit card and put the things they're gonna get.
Progress note, go to the bottom, credit card, and then we would go ahead and add honey gel. Done. And then we're gonna go ahead and do post-surgical kit. Done. So in this case, patient doesn't have insurance, so let's say that's their total.
Oh my god. I was like, what did this person get done today?
I think we have some items added.
Yeah, I think so. I think there's some things in this cart.
So we would collect the total. Just make sure that you add if they take the honey gel. If they only took, sometimes they'll say, let's say they want to take the aftercare kit and then the honey gel. We come back, we let them know their total. Patient gets a little bit taken back by the total. They say, you know what, I don't want to take the kit anymore. I'll just take the honey gel. Then we have to remove it. So here, you can go ahead and click on it. You can just go ahead and slide over and delete. Press close, and we have the patient's new total. Okay?
Major savings.
So then we can go ahead and close. We will help our patient with 2 weeks. The way we do it from our iPad, we go ahead and close our progress note. We'll go ahead and go right up here to the top. And here we can see the calendar. So we would go 2 weeks out. I'm just gonna go on a Monday so we don't. Let's do Sunday. Okay. And then we would try to fit them into our day, depending. So if we have patients, we'll go ahead. Let's say we had a patient at 2 p.m. and at 3 p.m. and she wanted afternoon. We'll let our patient know. I can go ahead and do 2:30 or I can do 3:30 because we already have a patient like here. So it'll be according to what patients you already have on that day. If they can't come exactly on like 2 weeks, we can do it like 1 day or 2 days after. If they wanted to like do it sooner or later, we would consult with Dr. Kormeili, and it will be depending on what she says.
Yeah, well, the problem with taking out the sutures too early is the wound can fall apart. So then they'll have a big giant gaping hole that has to heal, and it does take a while for it to heal, and patients are really upset about that usually.
And that's how you walk your patient through surgery and assist the doctor.
Perfect. Well done.